Hey y'all, how you doing tonight? I hope you're doing at least a little bit better today. And I'm sorry there's no live tonight. As Katie said in her presentation last night, ice, snow, and Texans just don't mix. So we will be getting back to the lives next week. We have some really good topics lined up. I believe we're gonna be talking about tests and what do we do when our tests come back normal. But for tonight, though, I have a different topic that I just want to talk about because I've had several requests lately, a lot of requests lately, because I've been talking about how we should try to find doctors that we can communicate with and have conversations with and who see us as humans first, and then as chronically ill, somebody's dealing with mental health struggles, or a chronic pain patient second. But they see us as a human first, and I feel we need to be able to have a conversation with our doctor. I'm not saying everybody has to find a unicorn. I pray that you do, but let's just try to find somebody who's better than where we're at. And so the questions that I've been asked of, they've been telling me or asking me, how do you interview a doctor? That's a great question. How do you go about when you're in that room, seeing if this might be somebody that can help you better than where you're at now, right? So before we get into that, though, there's some preparation that needs to take place. So you've decided that you want to see if there's somebody better out there, right? Okay, let's do this. What's the first thing that these are all just recommendations, and you can take them and throw them in the trash. You can take them to heart and try to apply them to your life, but these are things that I would do, and I was asked, so here they are. The first thing I would do is get a copy of the medical records of where you're currently at, of the PCP or the specialist that's in charge of your care plan for your chronic illness, your mental health, or your chronic pain. Get those records. Why is that important? Well, number one, there's a pretty good chance that your current doctor isn't going to get your records sent to the doctor you're going to see before you get there. So at least you can take a copy in and say, hey, if they haven't seen it yet, this is what they gave me. And your medical records I'm talking about are going to be more in depth than what you see in your app. They're going to be a lot more in depth. And that's why you want to see them. So you'll have them to give a copy to this new specialist or this new PCP. The second is you want to see if there's something that may not be correct in there. Is there a typo? Did they instead of saying that you are OUD, opioid use dependent, meaning that you depend on an opioid to have some kind of quality, help you get a better quality of life? Did they accidentally type you are SUD, that you're dealing with substance use disorder? You want to make sure that gets corrected, because I'm not dogging people who deal with SUD, but if you're not dealing with it, that needs to be corrected, or it needs to be at least brought up. Say, hey doc, why did you put this in my chart? Because that's not correct. And ask them to fix it. And if they won't fix it, ask them, hey, can I put my own little note in here to dispute this fact? Because you've never treated me like this. And right away, you'll know if they're not willing to change that accident, or let you put something in, that you're on the right track to finding a better care provider, right? Another thing that you may notice, and this has come up a lot, and this happened to me as well, you may see things that aren't in those records. Like my previous doctor, for 6 months, every time I saw him, his excuse for not increasing my pain meds, my opioids, was he said that I was dealing with opioid-induced hyperglycemia, something like that. It's a syndrome where the more opioids you put in your body, the more pain it causes. And for 6 months, he told me that I was dealing with that, even though we didn't do anything. That's a whole other story. But when I got my medical records from him, guess what? Nowhere listed in there could I find that he diagnosed me with that. Yet he told me that every time I saw him. So you want to find the important omissions or the important things that might be wrong and try to get those fixed. That's why you want them. Now, some doctors are going to charge you for it. I can't control that. Some doctors are going to fight you for that, believe it or not, because it's their personal records. If you are on disability and a doctor is refusing to give you your records, contact me and I can get you the number to the Civil Rights Division at SSI, and they will get the records for you. Just simple as that. So the first step I would say is get your records. All right, the next step, once you have that in process, getting your records, the next step is contact your insurance company. Does your insurance company require your primary care doctor to refer you to a specialist? Some do. Like my version of United Healthcare, unfortunately, does that. I can't just call a specialist to make an appointment. I have to be referred by my primary care doctor or by another specialist. And so if it does, when you go to your doctor to get that referral to the first person you interview, ask him, say, hey, if this guy doesn't work out, I'm going to go see someone else. Do I need to keep making these appointments, or can I just call you? Because it's a waste of your time and a waste of the PA's time and my time to come in here and just say, okay, Dr. Smith didn't work, I'm going to go talk to Dr. Jones. Can I get a referral to Dr. Jones? Can I just call and leave a message for you or the PA to have that recommendation or have that referral sent to United Healthcare or whoever you have? Because that, unfortunately, can extend how long it takes to get even in the door to these new possible providers if you have to continually make appointments with your PCP. Hopefully they'll recognize after the second, third time that you're interviewing people that it is a waste of time and that they'll just take it over the phone. So we've got get your records and find out from your insurance company what's required. So we have those two. The third thing I would say to do before you even start calling around to get into these other providers to interview them is you need to come up with an answer to a question, because you're going to get asked this question at least once, possibly twice, or possibly more than that. Either the PA that interviews you first, or the tech, or the doctor that you're interviewing, somebody's going to say, well, why are you here? If you have a care doctor now, why are you here? And boy, is that an explosive question. Because for a lot of us, we're dealing with buzzsaws that we're trying to escape, right? We've gotten terrible care from them. They're not either giving us enough pain meds, or they're refusing to send us to physical therapy, or they're only choosing one option for us, a surgical option that we're not ready for. We can't say that our current doctor's an ass. Don't say that. I'm begging you, don't say that. Why? Because when you're interviewing these new docs, they don't know you. They don't know you from Adam, just like they don't know your current doctor from Adam. And if you walk in and say, I want to leave my current doctor because he's an ass, what do you expect them to do? Because see, they don't know you and they don't know that doc, but they know that doc if they are a certified this or a certified that. They're a certified pain management doctor, for example. They know what it takes to get that certification, and it's not easy. So they're going to give that doctor a little bit of extra credence and belief over a patient that just comes in and says, oh, this guy's an ass. You understand? I'm not saying that's right. I'm just saying that's life, right? Because they know the steps that it takes to get that certification. So they get your current doctor has a certain level of respect by their peers. Again, I'm not saying that's right. And I'm not saying that the feeling that that we want to share or how bad we were treated isn't a valid feeling or something that we need to do. I'm just saying that that's not the time probably to do it. So when you're asked, if I'm asked, why are you here? When I was interviewing these docs, this was my answer. My current doctor says that the only thing that's going to save me or help me with my pain is a nerve stimulator. But he's not willing to try other things. I hear some patients are using ketamine as a way to get relief for an extended period of time. I hear some patients are having really good luck with strength coaches or strength training versus just regular PT. I hear some patients actually get referred to a dietitian, not just to tell us to lose weight, but what can we add to our diet that may help our flares be a little shorter, or may help our recovery period be a little shorter? More nutrition in our bodies might help us in the long run. And he's not willing to refer me out to these type of different therapies because he's saying only surgical options are the key. And I'd like to try all of other things, right? Let's try all sorts of things. I'm not necessarily against surgery, but can we try other things first before we do that? Do you see the difference? If you're willing to say, I want to try things to get a better quality of life versus why are you here? Well, because my current doctor's an ass. Do you see the difference in that? Do you see that it shows that you want to be active in your care besides just give me meds, give me meds, give me meds? Now, some of us, that's the only thing that can do. We have to have our pain managed. Dr. Leek talked not too long ago about how pain management is a term that's not really what we want. We want to get better if we can. And if we can't, like in my condition, there's no better for me. I can't be fixed, so I have to be managed right now. But for some, there are ways that things and therapies that can truly help get our condition better. And if you're willing to try some of those things, that's a much better way to present yourself, to sell yourself to this new provider that you're wanting better care. And maybe they have some answers, right? So be ready to answer that question. Why are you here? So we have our medical records, or we're in the process of getting them. We've talked to our insurance company, and we're coming up with a true, honest answer of why we're there that doesn't include dogging on that previous doctor. Okay, this next one I'm going to catch a little bit of flack from. And if you know me, I don't care about catching flack, because somebody asked my opinion, I'm going to give you my opinion. Get a copy of this. You Are More by Dr. Mike. And you can find Dr. Mike. He's all over Instagram. He's all over TikTok here, YouTube, all over the place. Not only is he trying to sell his book, but he's offering really, really good information. And this book has a lot of good information. I want to caution you, though. I do not recommend you taking this book in and reading page 93. Chronic pain patients should cause themselves pain. I don't recommend you going and reading that chapter to him, or quotes out of the book. I don't recommend photocopying sections and handing it to a doctor and saying, this is what you should do. No, please don't do that. Please. I love Dr. Mike. I've helped him give away books. I've bought books for people that couldn't afford the book. I bought my doctor this book. drmikesays.com. There you go. Or he's got a TikTok shop. You can get it there as well. Why do I recommend it? There's a section in here called a 3-minute life story, and why it's important. It's important because out of a 30-minute little time window that you have, the tech that takes your blood pressure and your weight and all that stuff, that's 5 to 7 minutes. And the PA is going to come in and they're going to assess you. That's another 5 to 10 minutes. So you're only going to get about 10 to 15 minutes tops with this new provider to interview them to see if you guys are going to be a good fit. So in that 10 minutes, let's take 3 of it and come up with our story, our life story, the who, what, when, why, and how we ended up in this dude's office, right? What's wrong with this? What are we willing to do? I recommend doing it in a format called SBAR, Situation, Background, Assessment, and Recommendations. Basically, it's a technique that doctors and nurses and PAs and anybody in the medical field is taught. It's a short description of the situation, assessing the situation, and getting down to recommendations, how to handle the situation, right? And if we can give them this information, if we can feed them our story in that format where it's easier for them to understand, I think that gives us a little bit of an edge. Anything we can do to make it easier on our care team is what we need to do. So like my situation. Hi, I'm Keith Johnson. I am 57 years old. I'm a white male that has been diagnosed and been living with chronic pain since 2016. Originally caused by a work injury, but in Texas, we only get 2 years on workers' comp, so no, it's not a workers' comp claim. This is an insurance claim. Background, that's who I am. That's the situation. That's who I am. That's a little bit of my background and what's caused, how I got into the chronic pain business, right? Assessment, simply, I have a lot of discs that are jacked up, a lot of issues in my back, starting in my neck. C5, C6, C7, I have a scar from where that's been caged. They did not replace the disc. They just caged it. Thoracic, T7, 8, 9, 9, 10, which causes radiculopathy across my chest to where when I lay down at night, if I lay on my back, I can only take half breaths because it hurts too much to take a full breath. Then you get down to S5, L1, whatever that is down there. And then L1, 2, L2, 3. The discs are bad there and they're pinching nerves. I also deal with sciatica in my right leg, neuropathy in my thighs and in my feet. That's my assessment. Situation, background, assessment, and recommendations. Doc, that's why I'm here for you. Currently, my current situation with my current pain management doctor, they're only offering one solution, which is a surgical solution. I would like to see if there's other options out there I could try. Acupuncture, chiropractor, nutritionist, therapy. What do you think? Or medications that I haven't tried, right? That's why I'm here, is to get your advice, because I may end up having surgery at the end. But can we wipe the table clean of everything else before we get to that point? There you go. You're going to be really tempted to tell them how bad this current doctor treats you. You're going to be really tempted to say, the medical system has screwed me over, and here's perfect examples of why. And those are all valid feelings. You're going to want to get them out, but can I beg you not to right now? And here's a simple reason why, just one reason. Because this new provider doesn't know you from Adam, just like they don't know your current doctor from Adam. You come in, and back to your why are you here, if you include all these horror stories in what's going on, and you say that this current doctor's an ass and they're not giving you pain meds, if this doctor doesn't know you, but he doesn't know that other doctor, he knows the hoops that doctor had to go through to get that accreditation to become a pain management specialist. So guess what? That doctor's going to carry weight simply because of his certifications. And if we just come in and say, I'm leaving this current place or because my doctor's an ass, or if we go into, my doctor won't give me pain meds, I live in pain too deeply, we need to come in and offer things that we're willing to try in this situation. As it develops, if you choose this doctor as your pain specialist, for example, as your relationship builds, things are going to come out about how you were treated in the past. Okay? This isn't the time to put all those stories out there. You're trying to get a vibe on this doc. You're trying to see if he'll offer solutions that you can't get where you're at, which may include opioids or pain meds, but other treatments as well to help you get a little bit better. Because remember, if we can get a little bit better by changing our diet, or we can get a little bit better by going doing PT, or a little bit better by going and talking to a therapist, all those little bits add up, y'all, and they stack up. When those little bits stack up, our quality of life improves. And maybe tell him in the assessment and recommendations, listen, some of me can't be fixed. I understand that, and we're going to have to figure out ways to manage it, and that's why I'm here. But let's find the causes of what's going on and see what other things that can possibly help before we get to the surgery option. You see how the difference is when you do it SBAR and you leave all the garbage about how we've been mistreated out? You're showing that you're willing to do the work to get better. And that's important. That's important to a doctor that you're trying to establish a relationship with. And this last one goes out to the ladies, and TikTok and Instagram and YouTube and everybody like that tells me that 75% of the people that follow me are ladies or identify as female. Welcome. How you doing? I hope you do better today. And that actually follows a national trend, especially in chronic pain and chronic illnesses. It's typically 75% women, 25% men. Now, guys, we're oddballs. We're not normal. Imagine that. So ladies, when you go to these doctor's offices, before you even make this appointment, you need to make a decision. Once you get your medical records, once you find out your insurance company, once you get your 3-minute story down, once you get all of that, you need to seriously think about how are you going to fill these forms out. Because some of these forms are going to delve into your childhood life. Things that happen before you're 18 or 20 years old. It's called adverse childhood experiences or something along those lines. It's worded different depending on which articles you read. What they're looking for is if you had any trauma in your childhood. Were your parents divorced? Did you grow up in a single parent household? Did your brother get arrested or something? Did you get arrested? Did you act out when you were in school, right? All these different things, including were you possibly assaulted as a child? Let's just put it that way. Doctors take that and they develop an ACE score. And for some bad doctors, they'll take that score when they can't figure out what's wrong with you. All your tests come back normal. Some bad doctors will tell you that you aren't really hurting. It's just all in your head. Your body and your brain is processing that childhood trauma and causing pain, and you need to go to therapy. There's a podcast that Dr. Leek and I did on this topic. I really recommend going and watching it. You'll find it here on the network. Just go back to the video section and you'll find it in there. And it shines a lot of light in the situation. Not all doctors abuse it, but some do. When they get to their end and they don't know what else to do with you, they'll blame it on that. So I'm bringing it up because when you go see these guys for the first time, or ladies, you're going to have all these forms and they're going to ask you, did you have any trauma in your childhood? I'm not telling you to lie. I'm not telling you to blow it off. I'm just going to ask a question. Does that doctor, the very first time that you meet them, need to know what happened to you as a child? Do they? Granted, 2 years, 5 years from now, maybe that's the ultimate cause, right? But is that what's important when you walk into that doctor's office? Do they need to know that right away? Or if you choose this specialist, this PCP, to be your doc, will that come out in time? Does it need to be brought out the very first time you meet them? I was molested by my grandfather. I'll tell anybody that. But they don't ask me that question. I don't know if I would put that on that form, to be honest with you. Because I'm not sure if that doctor that I don't know needs to know that information right away about me. So, food for thought. I can't tell you how to do it. That's your decision. So to wrap up, we have get your medical records if you can, right? Talk to your insurance company. Do you need referrals or can you make your own appointments? How are you going to answer that question? Why are you here? Your 3-minute story in Dr. Mike's book, and ACE questions when you go to see a doctor in the first time. To me, that's all work that needs to be done before we start trying to make appointments with doctors to interview them. And that is work. I understand that. It's not easy. Some of these questions are difficult. How do we leave out the trauma that we experienced? Because it's important to us. How do I answer those ACE questions? That's a lot of hard work you have to do. I understand that. But I also feel in my bones and in every fiber of my body that to get better care, I have to be willing to do the work. It's not as easy as just walking in demanding, I want $92,000 allotted a month. I paid for this visit. Write the damn script. It's not that easy. It's not, unfortunately. And if we want to have a relationship with the doctor where we can have conversations, we need to put the work in. It's not fair. It's not always right. We get abused. I'm not denying that. I've lived it. But at the same time, I want my quality of life to be better. I can be angry. I can be furious at what my previous doctor did to me. And I can shut myself in the bedroom and roll in that pain. Or I can try to find ways to be better. So I'm going to do that work. I'm going to find the answer to the question, why am I here? I'm going to sell myself to this potential new doctor because I want better care. Do this before you make the first appointment. That's my advice. So next week, we'll be back with the regular lives. Dr. Leek and the Dr. Dustin show on Monday. Jose, Baseball Strong on Tuesday. Katie, Nourish and Thrive on Wednesday. And then you get me and you on Thursday nights to wrap up what they had to say and to get our opinion out, because we can't be invisible no more. I love you guys, and I really hope tonight and today and tomorrow is a better day. And we'll talk to you soon.